ladies. We're going to do a reflection by John Milton. It says, "Gratitude bestows reverence, allowing us to encounter everyday epiphanies, those transcendent moments of awe that change forever how we experience life and the world."
We all have a different role. I would say that, so my role as a social worker is to kind of assess people for their ability to get into permanent supportive housing, to navigate getting their identifying documents, birth certificates, social security cards, IDs, getting to appointments. So Joy is our primary care provider, and so she does prescribes and fills medications for things like blood pressure, and if people are needing more intensive specialized care, we'll make referrals to Grady or to our main clinic. Stephanie's our nurse. She does a lot of like triaging and initial assessments. And on Wednesdays and Thursdays, we have a psychiatrist with us who treats people who have behavioral health issues. So it is a holistic, I guess, integrated approach to healthcare. Okay, so we're at a bridge that this is I-20 and Northside Drive, and there's a lot of folks who sleep under this bridge on mattresses, and traditionally the site, we come here and we say hi to folks, we give them water, but they haven't been so interested in receiving services from us. Like the guys over there now, they're just kind of sipping on a beer and playing cards. They're very relaxed and they're very friendly, but you know, they just, I think most of them maybe are medically stable. They don't really need any of our medical or psychiatric services. But nonetheless, we believe in the power of relationship, and we want to be here.
I'm Becca. I'm the street medicine intern for the summer. I'm a master's in public health student. So I get to come out with the team every day. I'll often go with Stephanie and see who's out here, provide water bottles, hygiene kits, see if anybody needs any medical care. And then if people do need medical care, I'm the MOS, so I'll input them into our system, make an appointment, and make sure that all of their paperwork is filled out so that they can see our provider.
What we do when we first get out here is to go ahead and assess each homeless person, each client, and just meet their needs to see what their needs are today. You know, with us providing medical services, we want to ask them, how are you feeling today? You know, what kind of medical services are you needing today? Some patients are already established. They just may need a refill on their medication. Some are out here that are sick, and we will begin to just go ahead and do an assessment to determine what kind of treatment the provider will be able to do at that time.
Here comes that older fella from last week. He's coming across the street. Hey, you're back. We're back. Good to see you.
Kind of in the bagged out.
Yes, sir.
Yeah. All
hey,
right.
Hey.
Okay.
Good to see you.
All right. Thank you.
A lot of times people will step up into the shuttle to see me. Sometimes we see people on the side of the road, wherever they are. And so we provide blood pressure screenings. We can treat a number of chronic conditions such as high blood pressure, diabetes. We see a lot of allergies and skin conditions that we treat. So we'll get a set of vitals. Depending on the person, we may get some blood work that we can send off with the rest of the clinic's blood. And then we can do physical exam that you can do with your clothes on, pretty much.
I've been out here for 2 months.
2 months?
Yeah, not really that long, but long enough.
Well, no, 1 day is too long.
Long enough, you know.
Yeah. Where were you staying?
Where was I staying? Well, I was staying at home then. Staying in my car, and I ain't got no car now. I was staying around in the car. And I got towed in. I parked in the wrong place and got towed in. There was no job. I was going to get out of the impound. all my people gone. My daddy's passed away, mom's passed away, all of them are gone. I really don't have anybody.
Okay.
Really
How long were you in your car?
Oh, probably 18 months.
The medical care is great, and you can get them plugged into services they really need. But I think the real benefit for them is the community and like the chance to interact with people. We can give them water, hygiene kits, just the little things that really make them feel better. And then a lot of them will just hang out and just chat with you. That's one of my favorite things, is just hanging out near the van, passing out water, chatting with people. They'll tell you their story. They'll tell you why they had a good day, why they had a bad day, anything like that. I think that's a lot of what brings them to the van.
I hate to say that it's growing in popularity, but it's growing in popularity. We're showing good results in a lot of what we do. And so we're seeing more and more street medicine programs pop up throughout the nation and internationally. And seeing a lot of good results of getting people into care, reducing costs of care for the hospitals, because we're keeping people out of the emergency room. And if we can help them access housing, that improves how they're able to take care of themselves and usually decreases their emergency room use as well, and decreases them getting arrested for things like urban camping.
He still smokes. He's down to a half a pack a day for the last 6 months, history of a pack a day for 30 years. He's interested in like tobacco cessation classes. He said it's just like hard with his depression, like to cut back. And yeah,
really the only thing that separates me as a housed person and our friends on the streets is literally our housing status. And anything can happen to any one of us that puts us in this situation. And so showing that curiosity about, so what's your story? How did you get here? And realizing that at the end of the day, we're all way more alike than we are different. And not everybody out here is, crazy or suffering even from severe mental illness, although a lot of people are. Not everybody's out here abusing drugs and alcohol, although many people are. People that you would never know are homeless if you walked up to them on the street. But we come out here and we see them with their bedrolls, and we know that there's something more going on. And so just seeing everybody's story, how different it is. There's just this assumption that we're going out like chasing crazy people around and just dealing with a bunch of substance abusers and people who don't really want to be housed. And everyone has their prejudices and their biases and their ideas about what homelessness looks like. And just, it's nice to show some curiosity about what actually does homelessness look like and realize how different it is for each person.